Flamazine cream. Contains 1% silver sulfadiazine. Mechanism of action. Silver disrupts bacterial cell membranes and DNA. Sulfadiazine, a sulfonamide antibiotic, inhibits bacterial folic acid synthesis. Spectrum. Broad-spectrum antibacterial, effective against gram-positive, gram-negative, and some fungi. Indications of Flamazine cream. Topical treatment of burns, especially second and third degree. Helps prevent and treat wound infections. Contraindications: Sulfa allergy, neonates risk of kernicterus. Side effects: local burning, itching, rash. Systemic rare leukopenia, methemoglobinemia. Delayed wound healing with prolonged use. Application: applied once or twice daily on a clean wound under sterile conditions. Special notes: not effective in deep infections or necrotic tissue. Requires monitoring for systemic absorption in large burns.